Hello, we are Kulima Afya. Our name is Swahili and it stands for Cultivating Health. We would just like to thank all the judges that we've seen today for being here and viewing our presentation. We would also like to thank the NMC for partnering with the Sparkman Center and the Lister Hill Center for this opportunity. Our target population are the elderly adults of the Maasai tribe and the Nashalai Maasai Conservancy. And the topic we chose to focus on was eye health. Eye health is a major health concern and cause of disability in Kenya. It is estimated that 80% of blindness in Kenya is caused by preventable and curable causes. There are two main conditions that affect eye health of Maasai elders, and that is trachoma and cataracts. Trachoma is a bacterial infection of the eye caused by Chlamydia trachomonas. Left untreated, as we can see, it causes extreme scarring on the eyelid and deformities of the eye that will eventually lead to blindness. Cataracts is the clouding and the hardening of the eye lens. It is associated with normal aging and other pre-existing conditions, but if left untreated, it will cause blindness, and it is the leading cause of blindness globally.
Understanding and preserving Maasai culture were important aspects when developing this intervention. Studies have shown that when armed with the right tools, Maasai individuals are effective at developing and leading interventions that improve health outcomes. With this in mind, rather than providing direct treatment, our project aims to create a bridge between the Maasai community and existing external resources. Our health model seeks to train local liaisons who will identify patients with advanced eye disease and provide education to the community. During this process, elderly Maasai individuals will be identified for treatment and connected to partners who can provide care. When combined with our sustainable business model, our intervention empowers the local Maasai community, increases knowledge of eye health issues, improves access to care, and ultimately improves eye health outcomes. In the next few minutes, I will describe how our health model will be implemented. We are very fortunate to have the opportunity to partner with Nashalai Maasai Conservancy, and we will begin by establishing a new project under their existing organizational infrastructure. Through NMC, the Kulima Afya Eye Health Project will recruit and hire one full-time staff member. This individual will be a respected member of the Maasai community who will provide oversight for this project. Next, the newly hired project coordinator will meet with elders from each of the villages within the Nashalai Conservancy area to offer enrollment into the project. Additionally, for villages who choose to participate, the project coordinator will request the elders identify eager and influential members to serve as the village liaison for the project, who will identify individuals who have advanced disease and provide eye health education within their villages. Once liaisons from each participating village are identified, a training will be conducted utilizing a multidisciplinary team of volunteers. These team members can be students and/or professionals in fields such as optometry, public health, health education, and various areas of medicine. Topics that will be covered during the training include those such as the disease process, signs and symptoms, risk factors, treatment options, prevention strategies, and basic data collection. Armed with information and resources, the village liaisons will go back to their village and implement education and visually inspect the elderly for signs of advanced eye disease. The village liaison will notify the project coordinator of individuals with severe eye health problems that may benefit from treatment. The project coordinator will then work with partner organizations to mobilize resources to link patients to the care they need. These external partnerships will be discussed later in the presentation. In order to preserve the Maasai culture and recognizing that they are experts within their own villages, we provide village liaisons autonomy in determining how to implement the education and screening interventions that will work best for their communities. We want to provide them with the tools and resources that empower them to take the wheel in driving change to improve eye health outcomes. Another important aspect of our intervention is data collection and analysis for evaluation, quality improvement, and to inform policy. The village liaisons will be trained on very basic data collection methods that will then be reported to the project coordinator. The project coordinator will regularly analyze the data and report the findings to external stakeholders. These findings will also be used to inform decision-making at the policy level to hopefully increase resources and funds dedicated to improving eye health among the Maasai community.
As we thought about our proposal, we realized that we needed a steady stream of revenue to not only support Kenyans as individuals and their communities, but also continue the educational goals established in this project. The Maasai have already established processes and have for years created beautiful handcrafted items due to previous tourism in the region before the COVID-19 pandemic hit. For our business model, we want to focus on those already established goods in their production and focus really on sharing the Maasai story to the global market. To turn this into an actual idea, we plan to hire one US-based part-time marketing manager whose main focus will be revamping the already established NMC social media, making an e-commerce site, creating competitive product packaging, and working with the product so that it is marketable in the United States market. After these tools are in place, we will purchase the goods directly from the Maasai at a very fair price that will allow the Maasai to have a steady stream of income. Goods will then be shipped from Kenya to an Amazon fulfillment center. Amazon will only be in charge of storing and shipping items, while the products themselves will be owned and sold by the nonprofit US marketing manager and the business that they create and the e-commerce site that they create. The US marketing manager will focus on pop-up events with items that may be produced in more limited amounts to kind of create some exclusivity with those and really market those specific items. With the use of social media, using influencers, it is allowing us to tell a larger audience about the Maasai story through their goods and an opportunity to market the NMC as a whole. With our business plan, the educational goals of our eye health program will have room to grow and develop with the financial stability.
Partnerships are, quite frankly, essential for the success of our initiative. And the reason we seek to form partnerships is to create a synergy between the Maasai community and existing infrastructure systems. These partnerships will remain independent from our initiative and the NMC, but they will help us with operations as requested. When we need help, we will reach out to partner organizations for specific assistance. We have identified 3 strategies to maximize the number of people helped through our initiative. For our first strategy, we will utilize the IAPB's help to obtain pharmaceuticals, medical equipment, and more. For our second strategy, we will work directly with the Fred Hollows Foundation to fully sponsor the medical care of elderly patients, which includes their surgery, transportation, and other related expenses. After determining which patients require immediate interventions, our project coordinator will connect them with the Fred Hollows Foundation to get every patient the care they deserve. For our third strategy, we will work closely with the Orbis HREF organization to lobby the government. To improve eye health across the nation, we will advocate for increased funding and a reprioritization of eye health in Kenya's national health system. Our educational model focuses on equipping the community with knowledge, but our partnerships are equally as important since they directly connect the community with medical care.
So this is the monitoring and evaluation we have for both our health models and business models. So the health model will be evaluated on a quarterly basis. The village liaison will collect basic data on people who have been participating in the educational programs, people who have been screened for eye disease, people who have been referred, and the number of treatments given. They'll pass that information on to the project coordinator, and they'll be analyzing those data and reporting it to our public and private partners. They're going to be looking for increased participants in the education program, increased number of referrals, increased successful treatments, and hopefully in the long run, they'll see a decreased amount of illness identified in the community. And that'll go to the public and private partners who will just take that and see how much funding and resources they need to provide to specific villages and areas. The business model will also be done quarterly, but it does a lot of the work for itself. So the Amazon fulfillment service has an analytics report that comes out each month that will let us know how many people are looking at our website, what products are they looking at, which ones are most most highly bought. And then the other social media analytics will show us how many people are on our social media profiles, the range of people across the globe that we are reaching, what posts are getting the most engagement, and all those reports will go to our marketing staff who will use them to inform our future marketing strategies.
The budget on the screen primarily shows labor costs for our 16 total hired Maasai people, as well as our one US-based partner. By hiring Maasai people, we are creating jobs that will allow them to support both their families and their communities. While the majority of our budget is focused on the most important part, which is people power, we have included smaller items for the business, such as a 501c3 application, general business overhead, as well as educational materials such as printouts and iModels. We strategically left the budget with a great deal of leniency to allow space to see how the business progresses further, as well as hearing back from our village health liaisons as they pinpoint specific interventions that are needed in their communities. With the revenue from our business, our nonprofit business, we eventually plan to provide finances for product production materials that will go directly to the Maasai, larger one-time business costs for the Maasai, and training needed to produce the great products that they do. On the educational and health side, our business is going to provide revenue to help with provide things such as medical supplies and sunglasses, antibiotics. Before we can really provide those items, though, the main part is being able to establish credibility and trust within the Maasai culture before we introduce any type of intervention. And if that takes 3 years, we have a long-term plan that's going to allow us to do that.
So we've specifically designed this model to be sustainable and scalable. And our models work hand in hand to combat the eye health problems that the Maasai tribe currently faces while maintaining their culture and empowering the community to make their own decisions. And our business model directly supports the educational model by raising funds and giving the Maasai tribes the economic freedom to make their own decisions. The profits that are generated by the business model can be reinvested back into the education model. This way, the Maasai tribes can directly expand the model to reach more people and improve eye health for the years to come. And as the initiative expands, this will give the Maasai tribe more control and autonomy over the initiative's operations.
Through the social ecological model, we can better see the effects of our interventions, as well as show that because we are working across multiple levels, our efforts are more likely to be sustainable. At the individual level, education efforts allow communities to increase eye health knowledge, screening efforts, and referrals. By forming relationships with respected leaders in the community, we can leverage the relationships to increase acceptance of activities that promote eye health. Partnering with reputable organizations connects us at an institutional level to provide resources to access treatment and assistance for the associated cost. On the community level, working with the community leaders will establish trust and credibility that will allow influence to be used to propel positive change. And finally, by collecting and reporting data, efforts can be initiated to advocate the government for increased funding and resources, as well as to inform eye health decisions for years to come. Our twofold approach provides social benefits on 4 different levels. We often hear the phrase knowledge is power. By increasing knowledge, we put power in the individual hands of the people to promote lasting health changes. This also supports autonomy, an important quality of the NMC. By increasing access to healthcare and resources through partnerships, the community benefits from efforts to increase quality of life. Finally, by expanding the market for local product, we're increasing income opportunities through an additional platform that allows for more product to be made and sold without flooding the local market. Throughout the creation and planning of our proposal, we purpose to never lose sight of the goals of the NMC, 2 of these being to reduce poverty and preserve culture. Our business model aims to reduce poverty through market expansion, addition of job opportunities, and through reinvesting in the community. Additionally, through our education efforts, we hope the community is encouraged to integrate Western medicine and practices in combination with their traditional approaches to strive towards more holistic care. While working to support these goals, we have provided another way to ensure that our efforts are sustainable and that the innovative direction of the NMC remains intact. Thank you again for taking the time to listen to our proposal. We're happy to take any questions you have at this time.
Thank you so much. We will now move into 10 minutes of Q&A with the judges.
Thank you very much, Team Kulima Afya. Let me start. I'd like you to go back to your budget slide, please. Yes, this slide. I was just surprised at the costs for a US marketing staff member, within your model. Thank you very much for, first of all, let me say, for a very, very interesting presentation. Some great ideas. Could you talk a little bit more about how you engage a marketing staff member for $9,000 for 3 years?
So that's a great question. Alex and I are happy to touch on that. This U.S. marketing staff member's main job is going to be doing pop-up events as well as handling the social media. So we're estimating that this will be about 10 hours per month. Between the two, we're expecting there to be about 2 pop-up events a month where this kind of personality will be able to go on things like Facebook Live and display those more limited scheme products. For the actual packaging, shipping, that will be handled by the Amazon sales fulfillment, which does have a monthly fee, but a lot of the fee cannot be assessed until later because it will be dependent on the specific product, like the height, the weight, and the way it will be packaged.
Also, we did leave a good bit of wiggle room in our budget. We weren't planning for this marketing role to be full-time, but if it does need to be full-time, we always have the room monetarily to add that.
Well, while we're on this page, first of all, thank you very much for a wonderful presentation. I'm just curious why you left almost $200,000 on the table. You had $300,000 available to you, and your project cost here $113,000.
Yes, sir. So one of the great opportunities that we had this week was to meet with our advisor and talk through some of our ideas with her. One of the things that she had mentioned from her time working in Africa was that your first 3 years are really going to be about establishing trust, really getting involved in the community and involving specific community members. So that's where our main focus was. Now we have less that additional cost and money that we were given. As we get more information from those specific liaisons from each community, we really want to hear what they need, what they think that their community would benefit from.
Okay, thank you for your answer.
Well, I can tell you the vehicle costs, maybe those are running costs and not the purchase cost, for a vehicle at $4,500 a year. So that is interesting. I liked your idea of working closely with NASHLI and the teams there. Could you talk a little bit more about the partnerships that you're looking to get into and to what extent those partners are already available on the ground in this community?
Yes, I can answer that question. So we're working with these main three partnership organizations shown on the slide. The main ones for patient care are going to be the Fred Hollows Foundation. It has offices in Kenya, in Nairobi, and they are already working with their own individual projects to help fund these surgeries and fund these interventions for the elderly people and for just patients in general. Their entire organization is focused on funding and basically fully funding these operational costs. And we want to partner with them. So once we identify the elders and the patients who need surgical interventions, we will refer them to the Fred Hollows or Foundation, and we'll through them we'll get the complete funding of all these surgical procedures, and they'll get the care that they need. And another organization that we're partnering with is the Orbis HREF. They also venture into this where they help fund surgical costs and medical costs for patients who need interventions, but they're also focused on a lot of these governmental lobbying and other actions like that. And in the future, we want to we want to lobby the government to basically reprioritize eye health in the community, and get more funding for eye health services and stuff, so that can actually improve overall eye health for the nation. And lastly, the organization IAPB, the International Agency for the Prevention of Blindness. They actually partner with organizations like the and offer low cost, cutting edge materials like surgical tools, diagnostic equipment, pharmaceuticals, and more. So partnering with them allows us to purchase these materials and just get them at a low cost.
Okay, thank you very much.
Hi, thank you for your presentation. I have a couple of questions as well. My first question is, with your health intervention in terms of providing education and screening and referrals for treatment, can you connect your intervention to sort of the gaps in the existing infrastructure for me? Like why is this a solution to the problem? Are the services not available and you'll be providing the services, or?
So yeah, in Kenya, their healthcare is mostly centralized, the doctors and stuff, the high specialized people are centralized in high impact rural areas, and the counties make their own rules of what they need for eye care in each county. So it's not spread equally, and especially in rural areas, there's a very small lack of resources for eye care. And we're going to be teaching them how to screen, but also using the partners to connect them to that care.
So the care is available, they just aren't aware of the care currently, and the referral will make them aware of the care? They're not able to reach it because the closest hospital is a full day's walk from their National Eye Conservancy, and also the prices, some eye care is not always covered, and vulnerable groups are not covered under the National Insurance Fund.
And
Thank
just
you.
to clarify a little bit, healthcare access is a big issue with the Maasai community. So our goal with our intervention is really to form a bridge between the Maasai community and those available resources. So there are available resources both through the government as well as private organizations, both domestic and international. So more than just necessarily referring people, we're really forming that bridge. So when we find out patients in the Maasai community who desperately need these services, we're then working to mobilize those resources and get them transportation, get them to those resources so that they can receive the treatment that they need.
Okay, so is it accurate to say that your solution is really focused on the transportation and the cost coverage for getting that care?
That's definitely yes, I would say working with our partners to identify where they can get treatment and then linking them to that treatment. So we're really forming, our whole intervention is really forming a bridge to the resources that currently exist. So in any way that they need that, whether that's transportation, whether that's funding, some organizations will come in and do mobile clinics for eye surgery. So we would be working with them to notify them if we have several people who need those surgeries that they could then plan a trip to come do, really mobilizing all of the existing resources.
Okay, thank you. And I know that we're almost out of time, but can someone speak briefly to the relationship between the health intervention and the business model?
Yes, so the business model is solely to fund our education endeavors. So of course, we want to make sure that this is something that has longevity, it is long lasting. $300,000 does not go a long way, even over 3 years. So to continue our efforts past 3 years, because that's not going to solve blindness in the whole of Kenya, we want to have a structure where there is consistent revenue being brought in to our nonprofit to eventually fund things such as transportation, further educational materials, hiring more people within the Maasai community. Does that help answer a little bit?
Yes, thank you.